welcome to our virtual RHA event. I'm Claudia, I'm the nurse practitioner here at Ooh La La, and this is Dr. Jacobs. We're really excited for all of the activities that you're going to learn about today.
Make sure you stay until the end for our live question and answer. Submit your questions via the questions tab and we will answer them live.
We'll also be giving away several syringes of RHA as well as discount through the end of the month. Stay tuned.
Hi, I'm Dr. Kristen Jacobs, and I've been an aesthetic provider for over 15 years. I love enhancing faces with filler. I take pride in offering my patients the most cutting-edge technology and services available in the United States. At Ooh La La, we only offer FDA-approved treatments and ones that we feel match our natural approach to healthy aging and wellness. RHA is the latest filler technology introduced in the U.S., and it offers me the ability to have an additional option to maximize results that leave you looking refreshed. There really is an art to aesthetic medicine. So think of me as an artist, and this product is an additional paintbrush or color in my palette to use to enhance your beauty.
RHA is specifically designed for areas with dynamic wrinkles. Dynamic wrinkles are the lines that appear with movement and various facial expressions. As we age, these dynamic lines can appear on almost any area of the face. As a nurse practitioner and injector, I've had an amazing opportunity to receive more training in the past year than most injectors receive in 5. I'm so blessed to have been able to do this extensive training with Dr. Jacobs as well as other trainers in the field. One of the most rewarding areas for me to treat are the cheeks and mouth areas. As we age, we begin seeing a fuller lower face to give that square appearance versus that harder oval that we're used to seeing when we were younger. Filler can be used in the cheeks to highlight the midface and lift that square appearance. It also can soften nasolabial folds and give you a refreshed appearance under the eyes. It's so extremely satisfying to show a patient that instant enhancement during the appointment. Lines around the mouth and thin lips are another area of concern that we see often. Filler can help give your lips and areas around the mouth the hydration it needs to appear more youthful and give you a little plump. What I love about RHA is that it's specifically designed to be more like the natural hyaluronic acid that we produce in our skin. It has fewer additives than other fillers and adapts to movement in the face necessary for everyday expressions like smiling, pursing the lips, and chewing. We want our patients to look more youthful but still look like you, and these products do just that. The science behind this filler is absolutely amazing. It takes every client's concern of looking natural to an entirely new level. It stretches and compresses within the skin without the concern of looking too full, stiff, or fake, even in the most delicate and challenging areas of the face. Here at Ooh La La, we see clients of all ages, typically from 20s to upper 70s. The reasons for filler treatment can definitely vary. Our overall goal with filler is to naturally enhance your best features in addition to treating some of the aging aspects of the face to keep you feeling refreshed and youthful. RHA, like other fillers we carry at Ooh La La, are very safe when used in healthy individuals with the right expectations. Before we do any treatment, filler or other, we take great care to ensure we understand your medical history and treatment goals before moving forward. There may be some situations where we schedule treatment around a medication you're currently taking or a special event that may be approaching. And if we feel like there's a better opportunity to meet your treatment goals, we can discuss those with you during your appointment. Sometimes this does lead to a discussion and referral to one of our trusted surgery centers.
The great thing about using a filler such as RHA is that the results are immediate. You don't have to wait for the product to kick in or for your body to build collagen or elastin such as you do with a laser treatment. However, there is a period of about a a week to 2 for most patients where we say you're not allowed to love it or you're not allowed to hate it. Filler is placed using a tiny needle, but it's completely normal to have some degree of mild bruising, swelling, and maybe some tenderness. We'll help during your consultation to schedule accordingly with any upcoming events that you have. RHA is known as resilient hyaluronic acid. Because it accompanies the face in everyday animation, it's a very long-lasting product. While patients would love a filler that never needs to be maintained, good providers want a filler that lasts long but not too long. Aging is dynamic and your filler needs to be well suited to this. RHA is approved to last up to 15 months, but to maintain correction, we recommend repeating your treatment every 9 to 12 months.
Hi, I'm Dr. Kristen Jacobs, and I have China with me today, and we are going to talk about what kinds of things we can do to enhance this beautiful face. So the first thing I usually do when I'm talking to patients is I ask them what's bothering them. And so they look in the mirror and, China, what's bothering you today?
So, as far as lips go, I do feel like my top lip is a little smaller than the bottom. So, a little more symmetrical would be nice. Maybe just a little fuller.
Okay.
Too.
How about anything else, like with cheeks or chin or anything? I'm not saying that's what you need, but is there anything else that bothers you?
These lines, I start to notice they're a little deeper than they were. So, I would say that would be the main thing there too.
So that is extremely common when patients come in and we're talking about filler, is that usually the first thing they point to is their nasolabial folds, and then a lot of times they'll say their lips, and then sometimes they'll say, just everything. So when I look at China, I mean, she, again, is absolutely beautiful. She's nice and young. She really doesn't need anything, but what we could talk about are some things that we could do for her to enhance that beauty. So anytime we start talking about filler, we always talk about the cheeks first. And what happens as we age, let me just get a little pointer here, as we age, everything seems to shift down. So we start losing bone mass, muscle mass, fat pads, and the skin laxity, it just becomes more loose, and so everything goes down. I say gravity takes over. So what that's doing is coming down and creating the nasolabial folds, and a lot of times creating marionette lines. China has the most beautiful chin. This is one of the things that tends to go away as we age. So obviously there's no enhancement needing here. So about a year ago, we actually did some RHA 4 in her cheeks, and I think it's lasting beautifully. So today we're not going to talk about, or we're not going to do anything about her nasolabial folds, but if we were, we would start injecting back here. And the interesting thing with cheeks is that it actually improves under the eye, it improves around the folds, it improves down here, and it will even give you a little bit of lip because it's pulling everything back up. So the purpose of filler is to start fighting gravity, start pulling everything back up. Once we put it back into place, it gives us a little bit more youthful look, and everybody is happy.
Thanks for joining us this evening. I hope you learned a lot. And now it's time for our Q&A.
But before we get to the Q&A, we gotta talk about the exciting stuff. Our giveaway winners will be notified via phone, so make sure you check your phone messages and texts. And then when we text you, make sure you respond with yes to see which RHA products are right for you. Hello.
Hi, everyone. Thanks for joining us. There's so many people here. This is so exciting.
This is awesome. Make sure that you ask your questions in the questions tab, and I guess we'll go ahead and get started if you're ready, Dr. Jacobs.
I am ready.
All right. We have quite a few questions in the box already. The first one says, how many areas can I get treated in one appointment?
Well,
Take it or
I think you can do all areas that you want. So our average patient will usually do 4 to 6 syringes in a single visit. And everybody's like, oh my gosh, that sounds like so much, but really it's not. We want to make sure we're getting enough of a treatment in there. And if you think about it, or here's a fact, 5 syringes is actually only 1 teaspoon. So if that puts it in perspective, it's only this much product that we're doing. So even though that sounds like a lot, I'm telling you what, you need that to see the results. So when you go back to thinking about the video I did, and we were talking about cheeks and we're talking about folds and lips, usually we'll start with 1 syringe on each side of your cheeks. If we need to address this lower area, we will probably do either a half to 1 on this each side when we'll do a syringe in the lips. So that's already 1, 2, 3, 4, 5. I typically like to do about 4, like I said, 4 to 6, but usually a minimum of 4 unless we're doing just lips. Do you concur?
I do. And I think it's almost like a trick question because, even just treating the cheeks, you're also treating smoothing out some of the heaviness under the eyes and giving you a more refreshed look, softening the nasolabial folds, and even some of the jowling we start to have as we age, it kind of helps lift that too. So I would say it's almost like a trick question, but also agree with what you're saying.
I think so. And then you brought up jaw, because if we really start adding in jaw treatments, you're going to add another 1 to 2 syringes on each side. So now we're actually going to be boosted up to like 6 to 8 syringes. And again, people think that's way too much, but really when you walk out of our clinic, you should not be able to tell you had anything done except for a little bit of bruising and swelling. And I think that was one of the questions that popped up is what do we expect after, and how long is it until I can exercise? And really the bruising and swelling, I think are I always hate to tell anybody that's not going to happen, because as soon as we say that, it's going to. So I'm a bruiser. I'm a big time sweller. So I always expect that. And you want to plan this out so that there's plenty of time to recover. So for instance, if somebody's getting married, like somebody, not me in this video little thing that we're talking about here, and wants a little bit of filler, we have to do 4 to 6 weeks before that big event, because we want it to settle in. We want it to look the best that it can. And that's about a month's time. Yeah. And the exercise question, sorry, I'm jumping back in, is that usually we say at least 48 hours. We want to make sure that you're not doing anything too intense.
Yeah. And the biggest risk with that too is, infection. Those little channels that we make with each injection are direct lines of infection, and our skin naturally carries bacteria, and sweat makes it travel even faster. So it pretty much, we just want to make sure that we reduce our risks of infection by, staying away from exercise for 48 hours. Let's see.
So one says that you wanted to know if you'll see a difference right away. And absolutely, that's why we love filler. Filler is instant gratification. It is incredible. But as I said in my video, you have to let it get a little bit of time to kind of make its way, the way it's supposed to be, where you're not too swollen, or, again, that bruising has to go away. So that's why we love filler, because we can see it. And somebody piped up, thank you very much, because she says, I love that both of you look really natural. And that's the result that we want.
Thank you.
Really, yeah. So that's really what we want, is we don't want anybody knowing that you had filler. I absolutely positively don't want anybody knowing that you had filler. We just want what you had said earlier, Claudia, say look rested and just look amazing.
This is a good question. Is this approved for all areas that filler is used, such as tear troughs and lips?
So that is a great question. And Technically, this filler is used, and I'm going to throw in one of these other questions because it asked, how is this different than other fillers? So this is a hyaluronic acid product, which all the other fillers that I use in my clinic are hyaluronic acid products. That's really what I like to use because they're so natural. If God forbid something does go wrong, we can reverse it. We can fix any kind of problems that if something does happen. So it's right in line with the other ones, but it moves with your face. It moves with the animation really nicely. And that's what makes this one different. Back to where it's indicated. So tear troughs, here's another trick question. We're talking trick questions is technically, I don't necessarily treat directly into tear troughs because what's happening is, as I said in the video, everything is falling down. So under your eyes, that's all falling too. So really what needs to happen is we need to give structure back to the face. So we have to treat cheeks first. And usually when we come in, because Claudia does this as well, when we come in to treat, we're going to go directly to cheeks. We're going to lift as much as we can. We're going to pull, which is going to improve this tear trough area. And it's now being referred to more as infraorbital hollows instead of that tear trough, because I think that it just mucks things up a little bit. So the other thing that we do is use some what we call a cannula, and we come in and we give support to underneath it. So I don't directly inject. Can we? Yes, we can. And will we? Yes, we will. However, you have to take all these other measures to make sure that you're doing it correctly. You don't want to ever just come in and treat here without addressing cheeks and addressing the little apples of the cheeks too.
Yeah. And one thing too is someone asked, will it help with the wrinkles under the eyes? And indirectly it does, but Botox is a great way to also help soften some of those lines around the eyes as well. So that's a good question.
That is a great question. And somebody just asked, do we need Botox with this? Yes. Hello. We always need Botox because Botox is what's relaxing the muscles. So not a dumb question by any means. It's a great question because a lot of people think that. Now, I'll tell you, sometimes when you treat out here, you don't need as much Botox, maybe. So the trick is getting the right adjustment of how much Botox do we need? How much filler do we need? But I won't go without my Botox.
Is there any concern with flying after having fillers done? And we always ask whenever you schedule your appointment, are you going to be flying out the next 2 weeks? We don't want anyone flying out. Just in the rare case that anything happens, we want to be accessible to our patients to, assist them if there's any issues that happen, and just, decrease our patient risk as much as possible. So that was a good question.
That's a great question. And we say safety first. So let's talk about some of the other things real quick, because I think I saw another one on there about the different things that we need to avoid. So dental procedures, including teeth cleaning, we want to make sure there's at least 2 weeks in between a dental procedure and coming in and getting filler. We also want to make sure, like you said, not to fly. No vaccinations in this crazy world that we live in right now. Everybody's getting vaccinated for one reason or another. And we want to make sure that you have at least 30 days because we really don't know what this can do. So if you have a question about it, certainly ask us. But if it's just a little gnawing at you, then just don't do it. Let's wait. Safety first, man. We want to make sure that everything is as in order as we can. Patients with autoimmune disorders, it's not that you can't do it. It's just that we need to talk a lot more about what can happen. Somebody asked, is it okay to take baby steps with filler? If I need 6 syringes, can I start with 3 to 4? So you guys with your trick questions here, because the answer is yes. However, what I always tell everybody, especially when we're talking, I just want to do 3. What I try to explain is let me do what I'm an expert at. And if we get to 3 and we don't see enough of a change, then we really need to go and do the 4th, maybe 5th, maybe 6th. Not that we always have to do that. I'm all about less is more. but I want to see results. And if we're not going to see results, then let's say you do 3 syringes and you see nothing. And let's say it was $3,000. I'm not saying that's how much 3 syringes are, but let's just say that. And you walk out of the office and you think, well, I just wasted my money because I don't have enough results. It's not because you didn't have enough. It's because we didn't do enough product to give the results that you need and that you deserve. It's a great question.
Yeah. I saw someone asked if I schedule a consultation, would I be able to get treatment the same day? Typically what we do is we do consultations first. We kind of go through what your biggest skin concerns are, and we give you different options. So at Ooh La La, we have what we call our skin plus body philosophy. So we spell skin a little differently. We go through all of your options for skincare, collagen stimulation, injectables, nutrition, and the 5th component, body. So you're getting, every single modality that's possible to help you treat your skin concern, because we never really want to address that concern from just one modality. You're going to get the best results from addressing it from multiple directions, whether it's, skincare and injectables, skincare and collagen stimulation, or a mix of all of them, and then adding on supplements and everything like that. So typically we'll make sure that you are a good candidate for filler, that our expectations for filler are realistic, that we understand kind of what to expect. And that way we can kind of go through what your first appointment with filler is going to be, and then schedule your appointment from there. So that's kind of how we go about doing our treatments. So do you have anything
Definitely.
to add?
And I mean, it goes back to the results too, is that we want to make sure we're doing the right thing, and that filler may not be what you need. I mean, I feel like everybody needs it, but it may not be the thing you want to start with. So that's why we have this great consultation where you come in and we talk about everything. It's all about education. It's all about offering you, talking to you about everything that we offer, and then making an educated choice on what we want to do. So I think, yeah, great answer. Let's see. I thought, somebody asked, what's the difference, or is it, I forget exactly how the question was. Why is this one different than regular HAs? And I think I addressed that a second ago, but just to tell you, it's a hyaluronic acid filler. So it's just different. We treat it differently. It's like I said, it's like another paintbrush. It's just another tool that we have in our little toolbox. And I really, really like the way RHA looks with expression and how people look with it. So it looks very natural. It just goes along. It plays well with others. So we'll leave it at that. Hopefully that answers that question.
Someone asked if, the corners of your lips turn down with age, where could I get filler to correct this? And this is one of my favorite areas to treat, actually, because it really can help. So what we do is we actually will offer support to the corner of the mouth by lifting it from the top and then coming underneath and giving a little bit of support to help kind of neutralize, if not, turn that corner of the mouth up to make it look a little bit more youthful. So I love that question, and I love the gratification I get when I get that result after treating the area and patients see that response, and it makes my day.
And since you're talking about that area, talking about lip lines, because a lot of people walk in and want, their lip lines fixed, which is a little difficult, to make it go away, but goes back to your skincare, collagen stimulation. And then if we get to the filler point, we're always going to address the lips first. And I think people are terrified of having their lips done. My lips are done. I love my lips. They went away. When you come into our office, you'll see my lips, my lip pictures from 2010. I think it's 10, 13, I don't know, and 2020. When I saw my lips in 2020, how much I had aged, because as we age, our lips go away. I was like, oh, it is definitely time for lip filler. So a little goes a long way, but that's the first step in approaching lip lines that are up here, whether you smoked or not. Somebody asked to address Botox and treating neck waddle. And that's a really tricky question, because that is not going to be my first choice to treat neck waddle. So surgery, if it's truly a waddle, that's the difference, is that we're going to send you on your way if we know that we can't help you. But surgery is what you really want to think about if you're doing that. If you don't want to do surgery, then collagen stimulation and skincare is going to be your first option. And then, yes, the use of some filler. Believe it or not, putting filler here, remember how we're lifting and pulling, it will definitely help this area. It's pretty incredible what kind of a jawline and what kind of submental lift we can get when we lift at the upper face. And then Botox can be used for some like neck lines, but it's not going to be our first thing that we pull out of our toolbox. It definitely won't be. But it goes along with it. And that's why I say it's a box of tools, and we can use all these different things to get the best treatment that we can. So
one question I actually get a lot is how do you choose what filler to use in a patient? And I'll give my answer, and then Dr. Jacobs, I'll let you give yours. But it really just depends on what the concern is, how severe it is. And, our job is to get you the most bang for your buck. We want to place it strategically and choose the right product that's going to give you the most change. So, is RHA better than other fillers? Well, there are some in some situations, I will choose an RHA over another filler, just because I feel like with what's going on and depending on what the patient has going on, I think, it will, it'll give them a better result. So depending on what it is, where it is, how severe it is, age, and all of that, that's how I go about choosing my product. So
good. I taught you well then, right? Yes. And so, that you absolutely nailed it. I mean, that's what it is. I'm not going to look at somebody and say, oh, this is what you need. There are several things that they could use, but there's going to be that you just know which one you want to use in that day. And again, this is why I like RHA in the lower face. I mean, I like it in the upper face too. Somebody like me, let's talk about that. Somebody like me who has a very thin face, RHA 4 is an excellent product to put up here for me. When we're evaluating, we're palpating on the face, we're feeling how much skin is here and how much it's going to lift. And so I would do a whole different technique with my face versus what we're going to do with Claudia in the next couple of weeks. And if you missed that, she's getting married in 2 months now. So we're going to be doing filler on her soon. So keep an eye out for that. But we're going to have a whole different approach for her. And that's why the consultation process is so important. We can't tell you over the phone for anything that we do really of what you're going to need or how it's going to work or what we think, because we have to see you, we have to touch and feel so that we know what we're doing. But each product has its own unique thing. And I always tell everybody, well, this is how I feel today. And then when you actually come back in for your treatment, we'll see how I feel. So it's really just a matter of, like you said, what do you want to do? What are your expectations? And it's the placement of it. And that goes back to how many we use. It's really, there really is an art to this, and knowing how and where to place it is what's so important when it comes to filler. Let me see if we've missed anything else.
Payment programs. So someone asked, is there a way to kind of, split up the payments? And yeah, there is. We have a Smart Skin membership where you can have a payment come out of your account every month, and you can help budget and save up for your treatment. And, within that membership, you actually get a discount off of filler. So there's one way to save there. That's one of our biggest, helpers with our patients, and, setting aside the money and kind of budgeting for that is, figuring out what the end goal is, when you want to have it done. Is there a special event we need to work around, and just kind of figuring out a monthly payment from there.
Good. And a lot of people did ask, how much is it? Because of course, that's what everybody wants to know. But what I challenge you is, when I say how much it is, what I challenge you is to really understand that we're giving results. And so when you think of this, you can't just think of it as, oh my gosh, it's $1,000. You have to think of it as, we're giving results. You have to look at how long it's going to last. You have to look at the technique and the skill and all of that we're doing. And don't freak out when, when you hear this, because we do have membership programs. We do have multi-syringe discounts. So really, before you make I think a judgment, come in and let us discuss it with you. And it's really funny because people, when they'll do the consultation with China or even Claudia, and they'll say, oh, I'm only going to spend this amount of money, and then I get them in the chair. It's just like when you go to nurse doctor, at a regular doctor's office, they'll tell the nurse one thing and then they come in and tell the doctor a different thing. But they'll say, whatever you want, you just do it, because they want to have the best results possible. And that's what we want. We want to give the best results possible. So for a single syringe, it can be anywhere from $630 to $1,000. So it just depends on which syringe or which type we're using, how long it lasts factors in, what product we're using, of course, decides what the price is. So like Claudia mentioned, the membership program is outstanding because that gives you a way to prepay for your services, but get discounts on everything. And if you know me well enough, or if you don't know me at all, I want to make sure you have results. So I'm going to make sure that you're going to get the best results possible at the best price you possibly can.
And you can expect to be in the office for an hour, maybe a little longer, depending on how many syringes that we do. So if you need to budget time out of your day for that as well, that is definitely something that we can talk to you about as well.
Good. So. And then one more thing, I'm going to do my little shameless plug of my book, because this has everything that you really need to know about our clinic. And you can get this on our website at KristenJacobs.com. But there's a whole section on fillers alone. Now, I wrote this and I did all of my models before RHA, actually, before I started using it in my office. So it's not mentioned in here. However, I use it just as much as I use the other products too. And I love them all. So it's not that it's not that I'm like, oh my gosh, I love this one, I'm never going to use this. I think there's a place, and that's what the scale is all about, is knowing when and where to use it. So I think that covers all the questions. If we didn't get you, please don't hesitate to give us a call. Alley points can be used for this. Yes, they can. That's what's so awesome about. Oh no, alley points cannot be. Sorry, alley points cannot be used for this. However, our membership points, and I mean the money that you put in your membership, can be used for that. Since it's a different company, we can't use the alley. Sorry, I was all confused.
And then just a reminder, you're going to get a text after the event. Make sure you reply yes, so we can schedule a consultation and you can take advantage of our specials from attending tonight's event.
I'm reading this. This is not a question, but oh dear, Claudia is perfect already. Yes, she is. And I have to tell you, when she came to me and said, I want filler, I was like, so she's going to look exactly the same. She's just going to look a little bit rested, and she's putting a lot of pressure on me because she's again having her wedding. But no, she looks amazing. She's beautiful. So thank you for that. So, okay. Well, I think that's it. And I hope to see you guys soon. We are doing from this event, buy 2, get 1 free syringe, which is a pretty big deal. You have to call and pay and book your appointment before August the 12th to get this special. Now, if you're just not ready, or if you just don't know, that's okay. Come in for one of our, come in and meet us, and we'll talk you through everything. Because really, I think it's all about education. It's all about understanding what we do, why we do it, how we do it. And then when you feel comfortable enough for, letting us do it, then, we're grateful for that. And we want you to feel 100% comfortable. So do you have anything else to add, Claudia?
I don't think so. I can't wait to meet you all when you come in for your consultation, so we can figure out what your best options are and come up with a treatment plan. So,
and thank you so much for spending, it hasn't been that long, but I don't know, 40 minutes with us, on I don't even know what day it is. Wednesday night? Thursday night. Thursday
I just had to double check. It's Thursday.
I know it's Thursday. Okay. So thank you so much, and we'll see you soon. Okay.
Thank you. Bye.